Are you grumpy? Are you tired? Are you just slow moving? Is that what's wrong with you this morning? Well, some people in the Northeast have a real thing they call snow fatigue.
I'm a commuter. I take the train and the bus, and it's been really hard. I feel a little snow fatigued because it's hard walking around the snowdrifts. It's hard on public transportation. You can't really go anywhere or do anything, and we've missed some days of work. So that's why I feel a little squirrely.
Maya in Boston, thank you so much for sharing it with us, because that's the way a lot of people are feeling this morning. So let's get the official on this. Let's figure out how to beat it together. Snow-tigue may not be a real medical term. We'll find out. But it certainly has some very real symptoms. And to help us recognize them, let's turn to Dr. Scott Woodruff. Dr. Woodruff, are you with me this morning? I can see you.
I'm here, Sam.
All right, perfect, sir. All right, good doctor, let's talk a little bit about this. When someone comes in and they tell you that they're feeling these things, particularly this time of year with the kind of weather we're experiencing, is snow-tigue a real thing, or is it something else they're feeling?
Well, snow-tigue isn't actually, as you said, a medical term, but it is something that relates a lot to a diagnosable term, which is called seasonal affective disorder, which your audience may be perhaps familiar with.
Yeah, I've heard it. Yeah.
Symptoms of seasonal affective disorder, it's a seasonal pattern to depression. So it's depressive symptoms that come on during the fall and winter months. So symptoms of that may be, feeling down, needing more sleep than usual, in general, like having a craving for kind of carbohydrate-rich foods, actually.
Yeah, now
well.
True. I mean, I lived in New York for 25 years, and in November I would go through it every year. Really had to talk myself out of it, so it can be pretty intense. Yeah. What do we do?
Yeah. All right. So the best things to do are really the similar things that you do when you're feeling down, all across the regular part of the year. So, as she spoke about, one of the limitations that you have is you're kind of stuck inside. So really getting clever in terms of how you can do things that tend to make you feel good. So these are things that either you feel like a great sense of accomplishment for doing, or things that you just tend to enjoy. The key is you want them to be things that make you, that are mentally and physically engaging at the same time. So that can be kind of tricky. The best idea is, as Maya spoke about, you can be limited in terms of how much you can go outside.
Yeah.
But really, if you can manage to get outside and particularly get some light, seasonal affective disorder is believed to be affected by light, and so the more sunlight you can get, the better. And for really, very, very strong cases, even looking into purchasing a light box and having treatment that way can be helpful.
So even as difficult as it is, Dr. Woodruff, we just have to tell people to try to get outside, try to get your face in some kind of sunlight if you can, and that'll help a lot. Thank you so much for taking time with us this morning. I know this sounds weird, but I used to make these walks in New York. There are these neighborhood like flower shops, so they have corner shops where they do have flowers, cut flowers. I used to just try to walk in there and kind of feel that. Reagan Medji is in New York right now. And